Hello and welcome. You're watching our special show, Coronavirus, Facts versus Myths. I'm Gargi Rawat. On this show, we'll get you all the latest you need to know about the pandemic and about the vaccinations. Also, we'll take some calls from you viewers on any questions and doubts you have about the pandemic and about the vaccinations. We'll have doctors with us who will answer your questions. On the screen, you can see the numbers there that you can call if you have any questions that you want to ask on the show. Now let's get you the latest data that has been released, and India today logged over 3.23 lakh new COVID cases, 8.4% less than yesterday, and 2,771 deaths in the last 24 hours. It's the sixth consecutive day when over 3 lakh cases have been reported in the country. The fresh COVID figure takes the country's total caseload to over 1.76 crore. Monday's deaths have taken the total fatalities so far in the pandemic to 1,97,894. Now, several nations, including the United States, have pledged to help as India is grappling with a severe shortage of oxygen supply and essential medicines. The US said it would send raw material needed to manufacture extra stocks of Covishield vaccine and also any equipment to help with oxygen supplies. The European Union, Germany, France and several other nations too have assured India of help. In fact, some help has arrived already from the UK. Now, there are many doctors across the world who are of Indian origin who've been very concerned about the situation in the country, about this crisis, and have been trying to help in any way that they can, be it monetarily, be it through information, be it through advocacy in the country where they now live. To talk more about this, I'm joined by Dr. Madhu Pai, Professor and Canada Research Chair of Epidemiology and Global Health at McGill University. Thank you so much, Doctor, for joining us. And I know that you, along with many of your counterparts there abroad, have been very disturbed by this crisis that you're seeing in the country. Many of you are doing your bit. You're advocating for more help for India. So tell us a bit about what you have been doing.
Yeah, I mean, all of us have somebody or the other impacted by this, Gargi. So I'm dealing with my own family members and friends who are sick and struggling to get any kind of medical care during this crisis. And, you know, obviously there are thousands and thousands of Indians outside India who are desperately keen to help. I get messages every single second. How can I help? How can I help? We have money, we have talent, we have expertise, there are tech companies, there are doctors. We are desperately keen to help. So we've informally started a group called India COVID SOS. The website is alive. And we have now more than 300 people of Indian origin from around the world trying to help. One of the first things that we wanted to do as a group was to make simple tip sheets to help people in India to deal with COVID at home. And we did it for our own family members, trust me. It wasn't something we had thought of. We've had to, in an emergency, come up with some plan. Like if you had COVID at home and you just cannot get hospital, cannot get medical care, what can you do? So the tip sheets we've now translated into Marathi, Gujarati, Punjabi, Tamil, Kannada, Telugu, Malayalam. It's all available on the website, can be downloaded. We've gone through 5 versions of the tip sheet and we've improved it based on feedback. And in addition to such advice, some of us are working on figuring out how to send oxygen to India or concentrators. Some of us are actively fundraising. I'm contributing almost on a daily basis to inspire others to do that. And we are also trying to do media here within North America, for example. Like there was a lot of advocacy to get Biden and Harris administration to finally send supplies and release materials to India, right? I'm doing something similar in Canada. I want the Canadian government to do more. Canada has received the Covishield vaccines, and it's time that Canada helped India in this crisis.
Right, Dr. Pai, so, we've been showing that tip sheet that you've shared online, on our screens. If you could just take us through that, because there's a lot of panic. You can imagine, the kind of scenes we're seeing outside hospitals. The minute somebody tests positive for COVID or even has symptoms, there's a lot of panic in households as well. So tell us about what you've said in this tip sheet about how to manage, COVID at home, and also when to escalate it and reach out for help from, the doctors.
Correct. And we're happy that the tip sheet has even been tweeted by the government of India, and it's being taken up quite a bit. So basically, if somebody has typical COVID symptoms, which we know what they are, right? Fever, sore throat, cough, so on and so forth, shortness of breath. Right now, it's challenging to get a COVID test. As you know, the backlog is incredible. So even my own friends and family have struggled to even get a test. So if you are in a high COVID area, you might as well take it that you have COVID, right? That is the only way to deal with this crisis. Just clinically say you have COVID. First thing is you isolate yourself. Don't go out and spread the infection to others. Open the windows, ventilate the house, wear a mask so that you can protect others in your family. But I must say, it's very hard within Indian households to prevent the infection that's why whole families are coming down right now, right? Because the virus is so transmissible, the newer variants. But do the best you can to not infect others within your house. Definitely no going out to gatherings, parties, all of that is finished. Definitely please stay at home. And then you have to hydrate yourself. Fever is a very common symptom. So a lot of fluids, hydration, paracetamol, basic things. And then get a pulse oximeter. The pulse oximeter is what tells us what the oxygen saturation in the blood is. In other words, are the lungs able to get enough oxygen, or is a lung congested so that the oxygen is not getting into blood? Pulse oximeters are available in pharmacies, Amazon, online portals. It's about 1,000 rupees or so. I understand that it's not easy for a lot of people to afford it, but if you can get it and monitor your saturation, if the oxygen saturation is 92 or above, there's no need to panic at all. You probably don't need to go to a hospital. You can manage this very well with symptomatic treatment, and then a simple budesonide steroid inhaler or a dry powder inhaler might help. It's more a preventive actually at this stage. And then of course, sleeping on your tummy, what we call proning, might help because oxygenation is better. But after a few days, some people will have an oxygen falling below 92. And that is when we start getting worried. If at that point you can get a telemedicine consult with your doctor or go to a hospital, acknowledging the crisis right now, it may not be possible. But once you reach that stage, that's when you start to seek care and try and get into a hospital. Once you get medical care, there is only a few interventions that are known to work with COVID. Obviously, proning helps oxygen. That is when oxygen therapy is really required. You need enough oxygen to keep your saturation above 92. Right? The lowest level of oxygen to keep it above 92. And in terms of medicine, the only medicine that has genuinely been shown by international clinical trials and accepted by WHO is steroids. Steroids are the bankable therapy. Dexamethasone is what is recommended orally for 5 to 10 days, but there are alternative steroids that can be used if dexamethasone is not available. So dexamethasone and oxygen pretty much is the mainstay of therapy. Now, remdesivir and tocilizumab, as you know, has made the news a lot for reasons I cannot understand. It is only used in really severely sick patients whose oxygen levels are really low, and it is not for everyone. It should not be used at home. There is no need to panic if you can't get remdesivir. And remdesivir might shorten the duration of hospital illness, but it has not even been shown to reduce deaths. So it is a marginally effective drug. It is not a magic drug. There is no need to panic. Convalescent plasma doesn't really work. So we've listed in our tip sheet a whole bunch of medicines for which there is no solid evidence to back them, and WHO has not endorsed them. No international guideline recognizes them. So we didn't want people to waste time, effort, and money taking medicines that were irrational or completely not necessary. So that's basically what the tip sheet says. And so at a certain point, you will need to seek medical care, but we hope that until then, you can manage the illness quite well using tip sheets or teleconsults with the doctors.
Already, yes, you've spoken about these medicines like, remdesivir, etc. But I have to say over here, it's quite a panic to get them, to access them, plasma therapy as well. Steroids, as you've said, that is something that is being included by many doctors. Doctor, you spoke about how you have family and friends here in India. You've been in touch with them. What are the challenges you've seen that they're facing?
Every one of them is struggling. Every one of them is struggling. We're hearing somebody sick, not getting tested, not even able to get to the hospital, 0 beds, difficulty in getting oxygen is a nightmare. Right now, I have a friend struggling and I'm managing him on WhatsApp. I'm looking at his oxygen saturation. It is starting to dip. I can't even get him dexamethasone. Poor guy is all alone. I'm desperately tweeting, finding some way to get him. I don't want him to, collapse into 80 saturation tomorrow, right? This is the problem. He's terrified of going somewhere, and no hospital is willing to take him because he hasn't had a COVID test done. It's like if you can't get a test done, the hospital won't take you. But right now, probably 1 in 10 people are getting tested because the testing capacity is overwhelmed by the number of people. So we need to switch to easier rapid tests. We should not be insisting on this RTPCR because India's RTPCR capacity is well been overwhelmed. Right? Lakhs of people need testing. There aren't enough laboratories in India to pull off RT-PCR. Even those who are getting tests are getting report in 4 days. That is not acceptable in this crisis. You can deteriorate a lot in 4 days. What happens if your saturation drops to 80 in 3 days? And you don't even have a COVID test. Now a hospital may not accept you, right? It's catastrophic. We need to come up with simple rapid tests, even home-based testing solutions to get people and a syndromic diagnosis. In other words, if you're in a hotspot, if you have these classic symptoms, take it as COVID, right? We have to have such pragmatic ways of managing. My friend said he cannot smell or taste. To me, that's a done deal. The minute he said that, you know what? You have COVID. I don't even need a test. But then I don't need a test to manage him, but the hospital might still ask for it, right? Will they accept his symptoms and say he has COVID? So this is the problem. I've been pushing him to get a test. He said, I cannot get a test. I can't get him steroid. This is becoming really desperate. And it's just hitting all of us personally now, you know.
Right, absolutely. Dr. Pai, thank you so much for speaking to us. And yes, it is quite a challenge here. Now, in some places, they've stopped demanding that positive RT-PCR test for hospitalization. But even then, getting a hospital bed is a huge challenge. Now, the other issue we're going to talk about, the government yesterday said during its briefing that the time has now come to wear a mask even at home. And this has, of course, created a lot of reactions among people wondering, you know, what does this mean? Though it is an admission by the government that there's been a major spread in COVID infection and a note of caution for people. It was Dr. V.K. Paul, member of Health Niti Aayog, who said this. And he said the time it's time to be at home, wear a mask and not invite people. He added that people should also avoid stepping out of their homes unnecessarily. Let's just listen in.
Please don't go out unnecessarily. Stay with your family. Very important. And also, even within the family, please wear mask. Please don't invite people into your home. This is not the time to do so. और घर में भी थोड़ा केयर रखिए कि किसी तरह से इन्फेक्शन कोई हो रखा है तो हम बाकी भी बच पाएं, क्योंकि ये दिखाई देता है कि ये वायरस तेज गति से पकड़ते हैं ये. And we protect ourselves and we protect our family members to the best of our ability.
Well, to talk more about this need of wearing masks at home as well as other measures that you can take and the situation we're seeing in the country, we're joined by Dr. Samrat D. Shah, MD Internal Medicine Specialist, Honorary Internist to Governor of Maharashtra. Thank you so much for joining us. Dr. V. Ravi, Head of Department of Neurovirology, Nim Hans, an advisor to the COVID Task Force in Karnataka. First to you, Dr. Shah, if you could, you know, a lot of people have reacted wondering, you know, what does this mean? Wear a mask at home. If you could just explain to us, you know, in which situation at home should you wear a mask? Many people live in joint families. You have elderly members as well. So if you could just talk a bit about that.
I think it's a right move by the government to, you know, take such stringent steps of, you know, asking our citizens to wear masks at home. It's as simple as that. When you're a kid who should fare well in his exams and he doesn't, you tell him that, okay, you have to aim at 90%. And if you do so, you will be there at 80, 85. Something similar. Okay, if you ask them to wear a mask at home, at least they'll be responsible to not wear a mask untidily or go without a mask in their building, in their society, in the community living. So at least on that note, I would say that, you know, government is being right by saying that you need to wear a mask at home. 80% of the times I've seen people wearing double masks, but that also it's not accurately worn. They wear it below their nostrils, which is as good as you not wearing a mask. So, you know, you need to mask it up. You need to rectify things. You can't say I'm feeling claustrophobic. You can't remove all possible reasons because the time has gone. This COVID-19 is entering each household and attacking it very badly. This double mutant strain, please do not take it lightly. It's going to not spare any single household. So
right.
if you feel so that, you know, you can further secure your family, by wearing a mask inside your own household, please go ahead and do so.
Right, Dr. Ravi, especially because right now we're seeing entire families getting affected with coronavirus. In the last wave, we'd see maybe one person and the rest maybe not get infected, maybe two people of one family. But this time around, it's a terrible situation for many of them. Their parents might have COVID, they have COVID, they're struggling. And perhaps that is why, this advice to mask up even in your homes to protect each other.
I entirely agree with you, Gargi, and thanks for having me on the show. There are two reasons why use of masks at home is being advocated. A, the infection is much more than what it was last year, 4 to 5 times more. And people going out can bring it in and the entire family can get infected. Not all households are ideal for home isolation. I think my friend Madhukar also told, you need good ventilation, you need separate rooms for each one. That is not a reality for everyone in India. So therefore, one should mask up at home. And lastly, the kind of virus that people are suspecting is spreading in the community has been shown to be more infectious. So that is also one reason. I would not say that is the main reason, but there are several factors that add up to why one should wear mask. I entirely agree with Dr. Shah when he said that when you wear a mask, it's important how you wear it, how long you wear it, and when do you change it. No mask can be worn for more than 6 to 8 hours because the moisture in the breath will make the mask wet, and once it is wet, virus from outside will travel through the water molecules as a vehicle and enter inside. So one has to keep this in mind and completely cover the nose, the chin, so that there is no gap for outside air to enter.
All right, yes, very important to wear it properly. Now we have a few callers also on the line with us. All right, we'll just connect to those callers. Dr. Shah, I'd also want to ask, people are wondering at what point do you escalate when you have somebody with COVID at home and you're monitoring their oxygen, at what point do you know it's time now to rush them to get, more oxygen support or take them to a hospital? Because this is something that is worrying a lot of people, especially given the kind of frantic search that is taking place for hospital beds.
Correct. So, let's put it that way. In the current situation and the scenario where we are, you cannot rely only on your oxygen saturation. There's a conglomeration or a accumulation of, on the whole, the spectrum of symptoms. Initially to begin with, it's never been that your oxygen saturation is going to drop from day 1, day 2, or day 3. It all starts with low-grade to mild-grade fever, and which gradually goes on. So first 5 days, most of our population, what they'll see is low-grade to mild-grade fever, with little sore throat, headache, constitutional symptoms of body ache, little diarrhea, altered taste, smell, and it's only after the 4th or the 5th day that once the fever still continues beyond that, that's when you need to be more smarter, more aware about your own cough symptoms, about your symptoms of breathlessness, whether your breathlessness at the start of the disease has escalated and now you're feeling more breathless during normal to mild exertion. These symptoms are extremely important. And finally comes your oxygen saturation. When every defense mechanism of yours has beaten up, that's when your drop in oxygen saturation will come. So if your oxygen saturation drops by 5% from your baseline, means when what you were on the day 1 of your symptom, it drops by 5%, that's when you need to get it noticed of your doctor or your healthcare system.
So that's very important for people to know. I'm so sorry, we have the callers waiting as well, so I'd like to get some questions in. Firdaus from Mumbai, go ahead with your question.
Hi doctors, I've been watching this program. I have a doubt. I am G6PD. Can I take Ivermectin or the one which is hydroxychloroquine or something like that? Just in case.
All right, Dr. Ravi?
Let me tell you that Ivermectin has been one of the drugs that people, along with hydroxychloroquine, were suggesting as prophylactic agents. Having said that, the data is not robust. Hydroxychloroquine also is a drug that in some people can cause cardiac abnormalities. So I would not recommend people popping them at home. Ivermectin is a drug that modifies the immune response. There are both papers for and against its use as prophylactic agent. Having said that, ivermectin is in the national protocol today for those who are COVID positive. So I would not advocate people popping pills at home. I would hand over to Dr. Shah for his comments. Over.
All right. I hope that's helpful for him. I'm so sorry. We have another caller, Muralidharan from Chennai. Go ahead.
Hello. Good morning, doctor. The issue is that first I was tested positive in the RTPCR test. Then I went to the local doctor. He gave some medicine. Then within 4 or 5 days, I became normal. I was totally all right. Then I was, in fact, I was in isolation for more than about 14 to 15 days. After the 14 days, out of anxiety, I took a test again, but I found it as positive. I was worried whether this positive is a thing which we should consider, or we should ignore it, or what do we do?
All right, Dr. Shah?
Yeah, so, like I said, the RTPCR coming positive in first 1 week of your symptoms, yes, it has a very high sensitivity and specificity. But, this WHO last year had already commented on this, that if your RTPCR comes positive beyond 11 days of your infectivity, it means that probably it's the dead viral particle which has been picked up by the RT-PCR test. And in true sense, probably you are not carrying that infection. Mind you, along with that, if you're not running fever, along with that, if you don't have breathlessness and you are RT-PCR only positive without any clinical signs or symptoms, then it's probably because of the dead viral particle.
That's some relief to Mr. Muralidharan, who says he was fine after 4 or 5 days itself. And one final caller, Pratap from Hyderabad. Go ahead.
Yes, thank you. Thank you for organizing these programs. These programs are of great help, especially at a time when doctors are very difficult to get, online or offline.
Do go ahead.
Yes, the first question is, in an apartment-like situation where we have, say, 20-odd residents, and if we find 2 or 3 residents, positive, now reports are such that the virus is moving in the air. So, is there a possibility when we open doors to pick up milk or newspapers, will there be any kind of transmission happening? That is one.
I'll put that to Dr. Ravi very quickly. Dr. Ravi, if you could answer that.
Yeah, see, when we say it is transmitted through air, the efficiency of transmission is highest in closed spaces. In well-ventilated spaces, the transmission is not very, very low when it comes to air. The distance is important. So I don't think by just opening your door to pick up milk packets and newspaper, you're going to get infection. Remember, human beings have to be there, or they should have just been there, coughed or sneezed, and it should be hanging in the air. That will happen more in closed spaces, well-ventilated spaces. That risk is almost minimal or not there.
All right. Well, thank you so much, Dr. Shah and Dr. Ravi, for joining us on the show and answering all those questions that our viewers had. Time for us to slip into a short break. We'll return with more. Stay with us. Welcome back. Now, a couple in Madhya Pradesh were married in their PPE suits on Monday. This after the groom had tested positive for coronavirus on the 19th. A video that has gone viral shows the bride and groom and 3 others in full protective suits at this wedding ceremony that was held in Ratlam. Chants could also be heard in the background as the couple goes around the fire and took those feras. Though many also reacted to this video saying, what was the need for a wedding at a time like this when most people are staying home, when they're being told to be very careful? What was the need to carry out a wedding ceremony even in PPE suits, even as the groom had tested positive for COVID? Well, that's all the time we have on the show today. Thanks so much for watching. Goodbye.